Antibody testing rolls out across America as WHO warns there is no evidence that people who recover from coronavirus have immunity. The World Health Organization has warned that recovering from the coronavirus may not protect people from reinfection as antibody testing kicks off across the United States, where there are more than 959,000 confirmed cases. There is currently no evidence that people who have recovered from COVID-19 and have antibodies are protected from a second infection, WHO officials said in a statement on Saturday. People who assume that they are immune to a second infection because they have received a positive test result may ignore public health advice, it said. The warning came as some governments study measures such as immunity passports or documents for those who have recovered as one way to get people back to work after weeks of economic shutdown. In a scientific brief, the United Nations agency warned governments against issuing immunity passports or risk-free certificates to people who have been infected as their accuracy could not be guaranteed. The practice could actually increase the risks of continued spread as people who have recovered may ignore advice about taking standard precautions against the virus, it said. At this point in the pandemic, there is not enough evidence about the effectiveness of antibody-mediated immunity to guarantee the accuracy of an immunity passport or risk-free certificate, WHO said. The WHO said it continued to review the evidence on antibody responses to the virus, which emerged in the central Chinese city of Wuhan late last year. Some 2.9 million people have been reported to be infected by the novel coronavirus globally and 203,000 have died. Most studies have shown that people who have recovered from infection have antibodies to the virus, the WHO said. However, some of them have very low levels of neutralizing antibodies in their blood, suggesting that cellular immunity may also be critical for recovery, it added. New York is starting to test healthcare workers for coronavirus antibodies and will do the same next week with transit and law enforcement workers as the state eases away from the worst days of the pandemic, Gov. Andrew Cuomo said Saturday. Doctors, nurses, and other employees at 4 New York City hospitals that have handled high volumes of coronavirus patients will be the first tested under the new program, Cuomo said. Antibody testing is a way of determining if a person has been infected by the coronavirus even if they hadn't shown symptoms. After weeks of reserving conventional coronavirus testing to people with symptoms to conserve supplies, the state is expanding eligibility to include first responders, health care workers, and a long list of essential employees, such as bus drivers, dry cleaners, undertakers and grocery store workers. Why? Because these people have been carrying the load and they have been subjected to the public all during this crisis, and because they're public-facing, Cuomo said. These are the people you interact with. Cuomo said he is signing an executive order to allow pharmacies to serve as collection points for testing samples. A recent study in New York City revealed that more than 20% of New York City residents tested positive for coronavirus antibodies. If accurate, that means that as many as 1.7 million people have been infected in the city and that the mortality rate is between 0.6 and 0.8%, far greater than the 0.1% mortality rate of the flu. The study took samples from 3,000 randomly selected people across the state who were chosen at grocery stores and had their blood taken via a finger prick test that the state's health department made. It remains unknown how accurate it is. While private companies have given exact percentages for how accurate their own tests are, when questioned about their test, the NY Health Department said only that theirs was very accurate. Statewide, the virus prevalence was 13.9%, but it was far higher in New York City, where 21.2% tested positive. A similar survey was conducted in Florida by the University of Miami. The study's preliminary results showed that about 6% of Miami-Dade residents have antibodies against coronavirus, 15 times more cases than the official tally. On Friday, the University of Miami said it estimated about 165,000 people had been infected at some point with COVID-19, the disease caused by the virus. That's much larger than the 10,926 confirmed cases that have been reported by Florida's health department. With 287 confirmed deaths in the county, it would mean the fatality rate is actually 0.17%, which is lower than the current official fatality rate for the county of 2.6%. Thank you for watching our video. Please show your support by subscribing to our channel and turn on the notification. Follow us on Twitter, Instagram, Facebook and Reddit for more videos.